All right, we're diving into the absolutely exploding world of telehealth today. So if you're out there building the next great healthcare platform, stick around. We're going to show you exactly how to find and, more importantly, protect the game-changing innovations that are probably hidden inside your technology right now.
So let's just frame this right. The telehealth space, it's basically a modern-day gold rush. I mean, the opportunity is absolutely massive, but guess what? So is the competition. Everyone is staking their claim. So the big question is, how do you make sure that your brilliant idea, your little piece of digital gold, is actually protected?
And that, my friends, is where patents come in. Look, for any startup in this field, a patent is so much more than a legal document. It is your protective shield. It's the thing that safeguards your unique edge in the market, and it's what keeps competitors from just swooping in and copying all of your hard work.
But where do you even begin to look for something you can patent? It can feel a little overwhelming. So I want you to think of your whole telehealth system like a treasure map. The real gems, the really valuable stuff, it's often hidden in the details. By breaking your system down into its core pieces, you can start to pinpoint the unique, innovative things that are truly patentable.
So let's go on this treasure hunt together. We're going to explore this map by looking at 4 key areas where innovation is just ripe for the picking. First, the communication infrastructure that connects everybody. Then, the data tools that are actually monitoring patients. After that, the data management systems that keep all that information safe. And finally, the user interface, which is how people actually experience your creation.
All right, first up, let's talk about the absolute foundation of telehealth, the communication infrastructure. This is all about that connection, that link between the patient and the healthcare provider. You know it has to be seamless, it has to be reliable, or the whole thing just falls apart.
And what's so cool here is how specific you can get. We're not just talking about having video calls. A patentable gem could be your unique system that dynamically adjusts bandwidth in, say, rural low-signal areas. That's not just a tech fix, you know? That's a massive competitive advantage. A patent on that could let you serve entire populations that your rivals just can't reach. Or maybe it's a proprietary method that seamlessly switches a failing video call to crystal-clear audio without ever dropping the connection. These are the details that build a truly unshakable platform.
Okay, let's move on to our second area, data tools and monitoring. This is where modern telehealth gets really exciting. I mean, we're going way beyond a simple conversation and integrating real-time health data into the mix.
And this right here shows you the incredible power of data. Do you have a special way of pulling in data from a wearable ECG or a glucose monitor? What if you have an AI algorithm that crunches that data in real time and alerts a doctor to a potential issue before it becomes a crisis? That is incredibly valuable. Why? Because you've just transformed your platform from a simple communication tool into a life-saving, proactive care system. And that is exactly the kind of innovation that healthcare providers will pay a premium for.
Okay, next up, we have to talk about securing all of this incredibly sensitive information. Data management is, well, it's absolutely critical. Innovations here are all about privacy, security, and, really importantly, integration with existing healthcare systems.
Now here's the key. Standard off-the-shelf security isn't innovative enough. But if you've developed a unique, multi-layered encryption method, well, that's a huge deal. Or maybe you've designed really clever access controls. But look at that last point, a new automated way to sync up with the hospital's electronic health records, their EHR system. That is a total game changer. Hospitals are drowning in data silos. A patent on a seamless integration method makes your product incredibly sticky and way easier to sell into those huge healthcare networks.
And finally, let's talk about the part of your system that users actually see and interact with, the user interface and user experience. Honestly, this part is so often underrated, but a revolutionary UI can be a really powerful and patentable source of innovation.
I mean, the possibilities here are just incredible. Imagine an interface that adapts based on a user's specific context. Or what about using augmented reality to guide a patient through a physical therapy exercise? But think about gamification, using game mechanics to boost patient engagement with their treatment plan. A patent on that process doesn't just protect a feature, it protects a mechanism that leads directly to better health outcomes. And that is the ultimate measure of value in this industry.
Okay, so you've gone through your system, you've found your patentable gems. Now what? Well, the next step is to officially claim your treasure, and you do that through the patent application process.
This whole journey can really be broken down into 3 main steps.
First, you have to do a really thorough search for what's called prior art. That's just a fancy term for any public evidence that your invention is already known. You got to make sure your idea is truly new. Second, you draft an extremely detailed application. This part is critical because it defines the exact boundaries of your protection. And third, you engage with the patent office, answering their questions and refining your claims.
Now, the good news is you don't have to go on this journey alone. You can hire a guide. A patent agent is a specialist who can help you draft and submit that application. A patent attorney, on the other hand, can do all of that, plus they can represent you in legal matters, like if you have to go to court, and they can provide official legal opinions. So, an early-stage bootstrap startup might go with an agent to save on costs, but a VC-backed company that's aiming for a huge exit, they're almost always going to invest in an attorney for that higher-level strategic legal oversight.
And it is so important to remember this. A patent is more than just a defensive shield. A strong patent portfolio is actually a powerful strategic asset that can actively drive your business forward. It's an offensive tool.
So how does this actually help you build your business? Well, think about it. When investors are doing their due diligence, a patent portfolio is hard proof that your technology is defensible. That directly translates to a higher valuation because you've reduced their risk. Or imagine you're approaching a big pharmaceutical company for a partnership. They are way more likely to work with you if they know your underlying tech is exclusively yours. And if you ever get into merger or acquisition talks, your patents are often the crown jewels. It's what the acquiring company is really paying a premium for. It just signals to the entire market that you are a serious innovator.
So we come all the way back to this question. In this telehealth gold rush, it's not enough to just find gold. You have to build a fortress around it. Your innovation really does have the power to change healthcare for the better. But is it built to last? Because protecting your idea isn't just some legal formality. It is the difference between a fleeting discovery and a lasting legacy.